Y-20 प्री समिट लद्दाख में सक्सेसफुली कंप्लीट हो चुका है और Y-20 प्री समिट में दुनिया भर से दुनिया के लगभग 100 से अबव डेलीगेट्स ने इस Y-20 प्री समिट में शिरकत करके मुख्तलिफ टॉपिक्स के ऊपर डिस्कशंस और डेलिब्रेशन किया है। और आज Y-20 के चेयर ने कहा है कि जितने भी टॉपिक्स Y-20 के प्री समिट में थे उन सारे टॉपिक्स पे राजी हुआ है सभी डेलीगेट्स और सभी डेलीगेट्स का कंसेंसस बना है। हमारे साथ Y-20 प्री समिट लेह लद्दाख में पार्टिसिपेट किए हुए यंगेस्ट डेलीगेट हैं जो कि ऑस्ट्रेलिया को रिप्रेजेंट कर रहे हैं और इनका नाम डेनियल है। Daniel, bro, thanks for joining with me. What do you want to say about Y-20 Pre Summit?
First of all, thank you for the incredible opportunity to have me on air. I'd really like to reach out to more youth across the world, especially in India. I think it's a very great opportunity to have. I'm part of the health track and my background is in youth mental health. I'm the youngest delegate to the Y-20, but also I'm the first founder of the youngest first mental health charity created by youth and made for the youth in Australia. And as a part of that, I want to bring that message to the Y-20 and also passing on to G20 leaders. That's what I hope to achieve.
So you have chosen one of the concerning topic like mental health. During the pandemic, the issue of mental health was rising day by day. And now after a post-COVID, there are lots of counselings and preachings and bridgings were held across the world to come up to prevent the mental health issues. So what do you want to say? What's your message to the youth of the world about the mental health and health and well-being?
Of course. When we're going through COVID, it was such a difficult time, especially for youth. You know, we have this saying that even though through internet technology we're more connected than ever, we are feeling more and more lonely. And the increasing rates of depression, anxiety and mental health disorders is due to the fact, not because we don't have the services to provide for these youth, but it's the fact that mental health is such a vulnerable, such a difficult topic for us youth to communicate about. There's so much stigma around it, and it's very uncomfortable for us to even talk to parents or even to medical professionals about it. And as such, during the pandemic, what my organization did was we went through schools, we went through educational programs to try to teach youth how to have a first aid level of mental health knowledge. And what this allows them to do is to have a base level understanding of how we can support one another, how we can support our friends at the very first level. This doesn't mean that we're all going to become psychiatrists, but it means that at the very first step, we have someone there to support us in times of difficulty like the pandemic. It's about us, but it's about us as a community, not as one. And if we can form a community of youth who know how to support one another in our policies and know how to support one another through our mental health, we can be in a much more harmonious world.
One of your biggest initiatives during pandemic, as you said, bridging. So how we can bridge across the world?
Across the world. That is kind of why I'm here as well. I strongly believe in peer support policy, where governments across the world should implement peer support as a fundamental part of their policy. And this means that we can build not only alongside the youth, but with the youth, creating these solutions that are spearheaded by young people and made for young people.
What sort of, during the deliberations and discussions in the indoor in-house technical session, what sort of discussions and deliberations were held?
I was very glad to hear that there's a very big focus on mental health this year, and when I did bring up my point on peer support, there was an overwhelming majority support for my ideas, which I'm very happy for. But amongst the health track, which is the delegation I'm in, there is a general consensus on one thing, and that one thing is that we should be making policies not with the youth, not for the youth, but with the youth. And that means that we have youth connected to us at every stage of the process. They're not just the audience that we're serving for. These are the people that tell us if it's working. These are the people that tell us what we need. And only by doing that can we create solutions that truly work and serve the people.
During the Y-20 pre-summit in Leh, the Y-20 chair in India said that all the 5 themes, all the delegates have consensus on all the 5 topics. So how do you see it? What's your expectation in the upcoming policy making decisions?
Of course. I think it's very promising to hear that the youth of today has reached some sort of consensus already. Of course, this is not the actual summit, and in the summit we will be narrowing these ideas down. But to hear that there is consensus, and with my track, I know that the consensus is one that is very hopeful for our future and for our policy making. I'm very confident for how these policy and how the negotiations will go for the future of Y-20.
And then some personal questions I want to ask to you. How do you see the topography of Ladakh, and what sort of accommodation, hospitality, and hosting you see?
Personally, I was very, very impressed by India's hospitality. The program was absolutely incredible. And to experience the people of Ladakh and to experience what the region truly brings to us is something that was truly a unique experience and something I'm very grateful for.
Thank you very much. Thank you. हमारे साथ डैनियल जो कि यंगेस्ट डेलीगेट हैं ऑस्ट्रेलिया से, डैनियल हमारे साथ बात कर रहे थे और इन्होंने Y-20 प्री सबमिट के डेलिब्रेशन के दौरान अपने किस तरह के विचार और पॉइंट ऑफ व्यू उस डिस्कशन में रखा है। और इनका कहना है कि जब उन्होंने अपना पॉइंट ऑफ व्यू रखा तो मेजॉरिटी का कंसेंसस बना। यकीनन हेल्थ एंड वेलबींग और खासकर मेंटल हेल्थ के ऊपर सभी को काम करने की जरूरत है आगे आके, और साथ साथ अक्रॉस द वर्ल्ड में ब्रिजिंग करके इन इश्यूज के ऊपर एक होकर हमें काम करने की जरूरत है। बने गुलिस्तान सफल के अपडेट्स आप तक पहुंचाते रहेंगे। मोहम्मद साहब, गुलिस्तान न्यूज।
National Health Mission UT Ladakh sis mimang sifia chirgo sis tabsdegama chatak basyotin disiriang National Ambulance Service in Haujos Emergency Helpline number 108 guzuk basyotin ga choksi gradum chigi wasika chonphok songkhanla swing duk chachos fali checha so sante bohar chok son chana domen ma khokpang yirim bomular gocha chana 108 dial base emergency service phankellen masa नाम संग योक्सबा मेडिकल रोक्स गोशाय होते चिबु गांबुक जरबेक छाना देवाक्सिका NHM स्ट्रुल्सबी एम्बुलेंस रोक्स लेन मिफिया डायल बाजार 108 नि योक्सबा बसे नतपा अस्पताल ला लेपचा छु बियांग खा फानिके लेपचा छु चेजरना तुस पुलेगी रिंचने yang ngata tusi max por taspayo NHM yo ngati roxi phia dial bazar 108 का dial 108 मोबाइल ऐप दक्षिण खरं डाउनलोड बसे फनकेलेन मजा National Health Mission UT Ladakh si phiosna mi mausi phan thoksa